Welcome to the Sleep to Dream Analytics Explainer video, where better sleep starts with better understanding.
All right, today we're going to talk about something with a name that sounds, well, kind of simple, right? Restless Leg Syndrome, RLS. You might also hear it called Willis-Ekbom Disease. But trust me, the reality of living with this thing is anything but simple. It's way more complex, way more disruptive than the name lets on. So, let's get into it.
So, have you ever had this happen? You've had a long day, you finally get to sit down on the couch, maybe put on a movie and just relax. But then it starts. This overwhelming, irresistible urge deep inside your legs, basically screaming at you to get up and move right now. It's a really strange feeling, and for a lot of people, it's super hard to put into words.
And look, we're not just talking about being a little fidgety here. Not at all. People who actually have RLS use some really intense words to try and explain what's going on inside. They'll say it's an uncomfortable, unpleasant, creepy, crawly, jittery, internal itch. The medical term for this is dysthesia, which is basically just a fancy word for a really bizarre, abnormal sensation. And honestly, if you haven't felt it, it's almost impossible to wrap your head around.
So, okay, you might be thinking, how does a doctor know this isn't just, a nervous habit or someone who just can't sit still? Well, that's the thing. RLS is a formal, diagnosable neurological disorder. It's not a habit. And to get that diagnosis, there are 5 very specific criteria that every single patient has to meet.
And these 5 criteria really do fit together like pieces of a puzzle. A doctor has to be able to check off all 5 of these boxes. So first, you've got that powerful urge to move. Second, and this is a big one, it starts up or gets worse when you're resting or just inactive. Isn't that ironic? The moment you try to relax, it kicks in. Third, moving around, like walking or stretching, actually helps, at least for a little while, so you're caught in this crazy cycle. Fourth, it has a distinct rhythm. It's almost always worse in the evening or at night. And last but not least, a doctor has to make sure nothing else could be causing these symptoms.
Okay, so knowing the diagnostic criteria is one thing. But to really get why this is such a big deal, we have to talk about the impact it has on a person's life. Because believe me, this goes way beyond just being annoying. For a lot of people, it is absolutely life-altering.
And here's a number that really puts it into perspective. We're talking about a 20% drop in work productivity for people with moderate to severe RLS. Just think about that for a second. Imagine being 20% less effective at your job every single day. This isn't just about being a little tired. It's a relentless, grinding cycle of exhaustion that makes it incredibly hard to just function.
Now this next point is, honestly, it's a bit of a shocker. When researchers compared the hit to a person's quality of life, they found that RLS is just as bad, if not worse, than other major chronic diseases we all know about, like type 2 diabetes or high blood pressure. Let that sink in. That is a huge, and I mean huge, and almost completely overlooked fact. And the damage doesn't stop with just day-to-day quality of life. No way. The constant lack of sleep, the stress on the body, it's all directly connected to some really serious health risks. We're talking high blood pressure, a greater risk of heart disease, and in some studies, even stroke. And of course, the mental health toll is just immense. It's not surprising at all that RLS is strongly linked to anxiety and depression.
So this all leads to the million-dollar question, right? Why? What is actually going on inside the body to cause all of this? Well, the answer is pretty fascinating, and it takes us right into the brain. It all comes down to this really interesting and kind of strange connection between iron and a chemical I'm sure you've heard of, dopamine.
Okay, and this is where we get to the core mystery of RLS, what's known as the iron paradox. So the condition is linked to not having enough iron, but here's the twist. It's not what you think. You could go get a regular blood test, and your iron levels could come back totally normal. But deep inside your brain, in the central nervous system, you could be seriously deficient. The problem isn't in the blood that's circulating around your body, it's a problem inside the brain itself.
So that lack of iron in the brain really messes with the whole dopamine system. But here's the real aha moment. It's not as simple as just having low dopamine. The real issue seems to be with how the brain's receptors are responding to the dopamine that's there. So think about it. Your dopamine levels naturally go down at night. That's just part of our daily rhythm. But if your receptors aren't working right, that's when the whole system kind of breaks down and bam, the RLS symptoms come roaring through.
So, if the problem involves dopamine, the solution seems obvious, right? Just give people more dopamine. And for a long time, that's exactly what doctors did. It made perfect sense. But, as they followed patients over the long term, they discovered a really dangerous paradox, one that has completely flipped the script on how this disease is treated.
And here it is. This is probably the single biggest challenge in treating RLS. It's a phenomenon called augmentation. And what that means is that the very medications that are supposed to help, these dopamine drugs, can actually make the disease worse over time. A lot worse. The symptoms can start showing up earlier in the day, they get way more intense, and they can even spread to other parts of the body, like your arms.
This chart really says it all. It's from a head-to-head clinical trial, and it just lays out the risk in plain sight. I mean, just look at the difference. After only 1 year, the risk of the disease getting worse, of augmentation, was so much higher for patients on a standard dopamine drug compared to a different type of medication. This discovery was an absolute game changer.
So today, the whole strategy is much more careful. It's a step-by-step approach. Step 1 is always to check for that iron issue in the brain and treat it if you find it. Then, if medication is needed, doctors now prefer a different class of drugs, the alpha-2 delta ligands, because they have a super low risk of causing that augmentation we talked about. Dopamine drugs, they're still on the table, but they're used way more cautiously now. And then, for the absolute most severe cases that don't respond to anything else, opioids are sometimes used as a last resort.
All right, let's wrap this up. What are the big takeaways here? Number 1, restless leg syndrome is a real neurological disorder with very specific criteria. Number 2, this is not just a little annoyance. It's a serious condition that can wreck a person's quality of life, their work, and even their heart health. 3, the cause is fascinating. It's all about that iron paradox in the brain. And finally, and this is so important, treatment is a really delicate balancing act. You have to avoid that trap of augmentation, where the treatment itself can make the disease even worse.
And that kind of leaves us with one last question to think about, doesn't it? Restless leg syndrome. The name itself just sounds so mild, almost dismissive. It doesn't even begin to capture the nightly torture, the deep exhaustion, the massive disruption we've been talking about. And it really makes you think, how many other serious conditions might be hiding in plain sight, totally misunderstood, just because they have a simple-sounding name?
Thank you for watching the Sleep to Dream Analytics Explainer video. We hope you sleep well and dream easy.